our talk about the use of acupuncture, pulse diagnostic, and the pulse maps. Again, I will remind you that we use acupuncture pulse diagnostic method written in book Nanjing, 81 Difficulties of Chinese Medicine. Unfortunately, unfortunately for acupuncturists, later this method was changed by Li Shijing, and we use now method in TCM, which is not acupuncture pulse diagnostic, it's the herbal pulse diagnostic method. So most difficult possibly to explain how to find deepness of each pulse. So for this case we use the pulse map, and I always was wondering if I can have some kind of instrument, kind of X-ray like machine which can tell me about the diagnosis and of the condition of each patient, and maybe provide me with some suggestion for the treatment. So actually pulse maps, they are these such instrument, so we can have the treatment prescriptions, the point prescription. We can analyze the treatment to see how treatment is going on, about the progress, and we can give prognosis what will happen with this condition, possibly nearest future. So here I have the example of the patient who came to the clinic. She had the cervical area headache with irradiation to the right eye. So what we can see here, again I will remind you, we have here the pulses of the Zhang organs like the lung, heart, pancreas, liver, right kidney, left kidney, and the four organs like the large intestine, small intestine, stomach, gallbladder, triple womb, sanjiao, and the urinary bladder. From this pulse map, after taking manually the pulse, we can actually differentiate. We find that the lung pulse on the level of the pancreas, so it's deeper than it should be. Very superficially is the heart pulse. Spleen and the liver pulses are in its place. Right kidney it's more superficial on the level of the spleen, and the left kidney on the level of liver. In four organs we can see that stomach actually on the level of the gallbladder on the level of the stomach, and sanjiao, triple womb on the level of gallbladder. So what it tells us? It tells us that there is some pathological qi penetrating in the lung, some deficiency in the heart, some deficiency in the right kidney, and deficiency in the left kidney, deficiency in the stomach area, and the excess in gallbladder area. And we can find the stagnation in the pancreas and stagnation in gallbladder. So as I said before, this pulse map provide us also with the indication for the treatment. So lung on the level of the spleen, we use the earth point on the lung, point number 9. Heart pulse on the level of the lung, we use the metal point on the pericardium meridian. We use also number 3 on the point on the kidney, right kidney meridian, because it's the earth point level of the spleen, pancreas, right kidney, and the level of the liver. So we use the number 1 on the left kidney meridian, so point, wood point. We also use the identically like the on the stomach number 43, number 34 on gallbladder, and number 3 in Sanjiao. What we can see also that, for example, as we have the headache with irradiation in the right eye, we can suspect that Yan Cao Mai meridian is involved. So actually, PulseMap show us that deficiency in the kidney meridian and not any deficiency in the urinary bladder meridian produced that we'll say relatively fullness of urinary bladder meridian, deficient kidney, urinary bladder. So it produces the fullness and start to fulfill Sanjiao meridian. So we use open also Sanjiao meridian because we can't see the flow of the qi in the extraordinary meridians with the pulse. So a few minutes after the treatment, we take the pulse manually, and we can see that some deficiency still in right kidney, some deficiency still in left kidney, still stagnation in gallbladder, and deficiency in the stomach meridian. We can compare these. This is right line what was before, and green line what happened after the treatment. Just a few minutes we can see about the progress of the treatment. So after the treatment, patient went home and returned in 1 week. So what pulse we have in 1 week? Again, manually we took the pulse and we see still some pathological energy still penetrate in the lung meridian, but of course much less than it was before. Still some deficiency in the heart meridian, some stagnation in the liver meridian, but no deficiency in the right or left kidney, some deficiency in the small intestine meridian, but not stagnation or the deficiency as it was before. So okay, we used again the points which were indicated by this pulse map, and what we can see what happened to the patient when she returned in 1 week time. So what we can see, some pathological energy penetrate in the lung meridian. Lung meridian resist this penetration. There's not any more deficiency in the heart meridian. Still some stagnation in the liver meridian, and a little deficiency in the left kidney. Here's the 4 organs, what happened before with these excesses and deficiency, and what happened afterwards. So after 10 years of the treatment, patient neurological treatment, she had not relief for her cervical pain, for her migraine with the irradiation to the right eye, and after 2 treatment, patient had not any more pain, first time in 10 years. So how we can find here if he is some excesses or deficiency? It's easy because lung 2 points up, and the connected large intestine just 1 point down, from here to here. Here's the small intestine 1 point up, heart 1 point down. Here it was 1 point down, it wasn't the same, so the differences was the excesses are deficiency. So we can see like the pulse map can indicate and help us with acupuncture pulse diagnostic. Thank you.